Well, nearly half of all American adults have high blood pressure, but there are some simple steps you can take to lower your numbers. I spoke with St. Luke's cardiologist, Dr. Tracy Stevens, to get the need-to-know information. Doc, let's talk about high blood pressure. Why is it one of the biggest health threats out there today?
High blood pressure is now the second only to nicotine as the most preventable cause of heart attack and stroke. It's the silent killer. It's the single most important risk factor that contributes to stroke, dementia, blindness, heart attack, heart failure, a rhythm disorder, atrial fibrillation that can cause strokes, need for dialysis due to kidney failure, and erectile dysfunction. And during this COVID pandemic, we have learned that uncontrolled blood pressure is a big risk factor for worse outcomes from infections with COVID.
Oh, goodness. Well, I know there's several factors that go into what our numbers are. Let's talk about what they should be and what's the easiest way for us to know our blood pressure just at home.
The number one thing I ask our community to do, especially now, is to have a blood pressure cuff in your own home. Self-monitor your blood pressure. That's the key. Purchase a blood pressure cuff. It's easy. The upper arm blood pressure cuff, fully automatic, connected to a battery-operated box. All you have to do is push the button. It'll do the rest for you. Bring it into the next clinic appointment. Let's make sure it's accurate. It gets confusing where we want your blood pressure to be. Ideally, we say 130/80. But there are certain conditions we may want it lower. If it's consistently for a ballpark range, say keep it well under 140/90. If you find it's consistently at that number or higher, make sure you reach out to your physician, your healthcare provider.
And what are some of the top things that people can do to lower their blood pressure?
First and foremost, stay active. Check your blood pressure before you exercise, and then check it soon right after you exercise. Nutrition also. And we hear about eat healthy, and it gets confusing, but very, very basic. Fresh vegetables. You look at your plate, half your plate, fresh vegetables, a quarter fruit, a quarter protein. And really adopt a healthy, not a diet so much, but healthy lifestyle. So eating healthy, staying active. Stress is a big one. We can't get rid of stress, but how we can deal with it, whether it's through eating healthy, exercising, meditating. And also important is get a good night's sleep. Read the labels. If sugar and salt are in the first 4 ingredients, don't consume it. And so eat healthy, exercise, get a good night's sleep. Try to deal with stress. Take your blood pressure medicines if they've been prescribed. We're finding now people are hesitant to go into the pharmacy to refill their medicines. So during this pandemic, we're seeing a lot of high blood pressure readings in our patients in the community where otherwise we wouldn't have.
And then finally, when should someone seek treatment for high blood pressure?
I think if you're self-monitoring your blood pressure and you're finding those readings, certainly if they're consistently at 140 for the top number or the bottom number 90 or greater, reach out to your healthcare provider.
Always great information there from Dr. Stevens. To get the expert help you need, go online to St. Luke's KC.